Good evening. This is Marcia Noel, assistant to the city manager, moderating tonight's community teleconference call. We thank everybody who is listening in for updates regarding the COVID-19 pandemic and what we are doing as a city responding to it. So with that being said, before we begin, I always encourage our community to share this recording. If you're watching on YouTube or Facebook, we ask that you please share this video with those who can be interested in this as well, family, friends. We would certainly like to spread the information around as we know we are in critical times. So with that being said, we do have our city manager, Jonathan Evans, and our fire chief serving as our operations section chief of the EOC here to provide you updates, as I've mentioned earlier. And so with that being said, without further ado, I will hand it off to
are approaching the year anniversary since the city of Riviera Beach went into the activation of our emergency operations center and deployed our incident command system. At last night's meeting, we had an opportunity to present to the city council a year in review and all the things that we've been able to accomplish over the last year as it relates to this pandemic. And so I'm going to go over a couple of items that were shared with the elected officials so you all are getting the same information. So first and foremost, the question that we routinely get asked is what is an EOC? Well, an EOC is our Emergency Operations Center. It's a physical location or a virtual location. In these COVID times, we've had our environment change drastically to where most of our communications have been in a digital format, such as you all, as it relates to your activities related to your employment. The intent behind the activation of the EOC is to support in the emergency response effort to make sure that there's continuity of government, continual conversations and crisis communication activities. All that is mapped out in those particular spaces, whether it's virtual or in a physical sense. We deployed our incident command system, which is described under the National Incident Management System, or NIMS, and referred to for a combination of facilities, equipment, personnel, procedures, communications, and we're operating within an organizational structure. This structure is intended to facilitate our best approach as it relates to disaster management or emergency preparedness. So there are certain skill sets as well as certain positions that are required to be part of the incident command system to facilitate a response to whatever situation, whether it's an epidemic, pandemic, hurricane, accident, incident. We have a list of positions and persons that serve in those positions. As the city manager, I serve as the incident commander. Our operational section chief is John Curd. Our planning section chief is Mr. Terrence Bailey. Logistics section chief is Richard Blankenship. That position was formerly held by our procurement director, Ms. Althea Pimsel. Our finance section chief is Randy Sherman. Health and Human Services section chief is Ms. Valerie Grimsley. And our legal section chief, Ms. Dawn Wynn. We also have our leisure services branch that was utilized when we did open and close our beaches. And then we have our public information officer, Ms. Marcia Noel, working in collaboration with Mr. Walter Stevens, our multimedia supervisor. So in February of 2020, we started to see things occur in Wuhan, China, as it relates to this pandemic. We have seen that the containment of the virus was next to impossible. The transmission and the infection rate was growing exponentially, and there was a concern that this virus may reach our soils. And so we started to move quickly to begin planning how we would respond in the event that this virus impacted our agency and our community. So we began the operational section as well as the planning section to begin working through our incident command systems. We began the pre-planning process. We started to look at what safety protocols and procedures would be to ensure the health, safety, and welfare of our public as well as our employees. In March of 2020, we saw that our Emergency Operations Center activated on March 20th. On March 27th, we declared a local state of emergency for the city of Riviera Beach. We developed a remote staffing model that has been created. We created multiple policies, community teleconference calls. We looked at how we can disseminate information to the public in a timely and effective process. And then we sourced and acquired well over 30,000 face masks. And a lot of that PPE, personal protective equipment, was disseminated to the public. So we were already beginning the process of what was anticipated to be a long situation. And obviously, we're still in a state of local emergency as we're dealing with the pandemic now, and will continue to do so. We facilitated early communications, whether it's providing community with latest developments concerning COVID-19, community calls, discussion on beach closures, and what are the things that we have done to ensure that our community as well as our workforce remains safe. We adopted, in April of 2020, we adopted multiple new organizational policies, from teleworking to return to work to pandemic pay. We enhanced building cleaning and protocols and ensured that every person that would be entering the facility would have to be screened for COVID. Citywide, we had our employees complete their National Incident Management System training and certification, which logged approximately 3,000 hours. Persons have to be certified in their National Incident Management Systems training through the Department of Homeland Security that speaks to the incident command systems. And employees have to have 100, 200, 700, and 800 is recommended to be able to work in an emergency operations center. So for the most part, all our employees have complied with that request that was put forth by administration. We established a Health and Human Services Section Chief, which helps in facilitating the food distribution as well as now the vaccination of our community. We also looked at following the same type of protocols with regards to essential and non-essential businesses when businesses were to be closed to attempt to address the growing spread that we had of COVID-19. From May to December, we met the needs of the community. We established testing at the Wells Recreation site, regular food distribution and mass distribution. We probably distributed well over 15,000 pallets of food, or 15,000 families have received food from the city of Riviera Beach, and we have disseminated well over 30 to 40,000 masks. We have implemented a contact tracing program, so if an employee does test positive, we can inform their peers and make sure that they're checked on a daily basis. So if there is any issues, we can come to assist in any capacity that that particular employee may need or family member may need. So from January 2021 to March 2021, we have established a point of distribution in the city of Riviera Beach for the COVID-19 vaccine. We've been successful in acquiring a long-standing pod with the state of Florida to where we will be able to vaccinate well over 600 persons per week. The vaccinations will occur Thursday, Friday, and Saturday, and that will occur as long as we are still able to receive the vaccine from the state. So we are very fortunate. We are the only municipality in Palm Beach County that has that particular model where the site is completely ran by your City of Riviera Beach employees, and we're very proud of that. We've also acquired a new emergency management software that has allowed for us to push out information, whether it's related to COVID or things that the community needs to know about community meetings, activities, programs, etc. We've logged over 8,000 call minutes associated with that program, and we have acquired new personal protective equipment to comply with the CDC's recommendation. We're a very resilient community. We have still tried to provide some form of normalcy. We've done multiple, probably well over 150 birthday celebrations, parades, you name it. Our folks have been out there in the community making sure that people realize that your elected officials, administration, and staff care, and we want to make sure you get the appropriate tools necessary to be safe during this pandemic. And so there has been a lot that we have accomplished. If you'd like to see more information, we have well over 7 pages of accomplishments and things that the city has worked on since the onset of the pandemic. So with that being said, that concludes my comments and my report for this evening. Ms. Noel, I turn the call back over to you.
Thank you, Mr. Evans. And now I'll turn it over to our Operations Section Chief, John Kurt.
Thank you, Ms. Noel, and thank you, Mr. Evans. After that, I'm not quite sure how to follow up, but I'll do my best. From the Operations section and also speaking tonight from Health and Human Services, as always, I like to talk about the numbers to make sure we keep things into perspective as it relates to the pandemic. In the United States, we have seen a total of now 29.7 million cases of COVID-19 with 538,000 deaths. In the state of Florida, there's been 1.99 million cases of COVID-19 with 32,000 deaths. And in Palm Beach County, we've seen a total of 127,000 cases of COVID-19 with 2,586 deaths reported. I've been monitoring the daily positivity rates. They seem to be fluctuating up and down somewhere between 6 and 7%, depending on the day. So we are seeing the numbers come down gradually. And the census tract data for our area in Riviera Beach is actually doing quite well, I must say. We are not considered a hotspot in Palm Beach County. There are some communities to our north and out west that are considered hotspots. But whatever it is we've been doing it right, and we must continue to do, as there is always a potential for what is feared to be a third wave. We know we will inevitably see a spike due to spring break in Florida, as Florida is a destination for many spring breakers. But we want to make sure that we're still adhering to those CDC guidelines on whether it's physical distancing, wearing our masks, washing our hands, sanitizing our hands, and making sure we're doing all of those things that we need to do to prevent some of the shutdowns that we are now seeing in the UK over in England, where they have now hit a third wave and have gone back to some of the restrictions that we're seeing early on in the pandemic. As it relates to vaccinations, we are doing quite well. As Mr. Evans mentioned in his speech, we are one of the only municipality running its own vaccination pod. There are other municipalities who are working through the healthcare district of Palm Beach County who are doing great jobs. But we are very proud of what we've been able to accomplish in Riviera Beach. We are vaccinating again every Thursday, Friday, and Saturday. We're vaccinating 600 people a week. That's 200 people a day, 3 days a week. We have a planned steady rotation for vaccinations. There will be some messaging going out to the community tomorrow on when they can next register for the vaccinations in Riviera Beach. And actually, the state of Florida has done quite well. Actually, the state of Florida ranks third amongst all states in the United States on the number of individuals fully vaccinated. We have vaccinated 2.63 million individuals. That makes up approximately 12.25% of the population. There have been over 7.52 million doses given in the state of Florida, and we're going to continue down this path until everyone who wants a vaccine has received the vaccine, and hopefully we will be able to achieve herd immunity where we will be able to put this pandemic behind us. I don't think it'll ever go away, but we will be able to put it behind us and we can ensure that if people do become infected, they won't die as a result of their infection. And please understand that that is the intent of vaccination. The vaccination is not a force field. The vaccination will not prevent you from contracting COVID-19. The vaccine is merely a tool to help you live and not die if you are to become infected with COVID-19. There are many vaccinations out on the market now. The city of Riviera Beach is utilizing the Moderna vaccine, which is a 2-shot regimen. We know the Pfizer vaccine has been out for some time, and now there's the Johnson & Johnson vaccine, which there were some reports today that Florida would not be receiving any more of the Johnson & Johnson vaccine. So there's a lot of politics that are associated with this, but we're going to navigate that for you to make sure that Riviera Beach has vaccines of some level for our community. Please understand that our vaccination site is governed by the requirements set forth by Governor DeSantis in the state of Florida, which differ from the federal requirements that you will see at some of the federal vaccination sites. A lot of your pharmacies are operating under the federal pharmacy vaccination program, and they follow federal guidelines, where here in the state of Florida, with the pod that we're running being a Florida-sponsored site, are required to follow Governor DeSantis's orders. And some of those orders differ in the individuals that can get vaccinated. The state of Florida has teachers being vaccinated that are 50 and older, where the federal vaccination sites will vaccinate any teacher regardless of age. So there are always some nuances to the different sites, but please understand that we are doing the best we can, and we've actually done very well to partner with not only Palm Beach County and their administrative team, the healthcare district of Palm Beach County, and the state of Florida to make sure a steady vaccine is flowing throughout our community and our neighboring municipalities. So we're going to continue on this front. This is priority number 1 for the city of Riviera Beach. We have transitioned from testing to food distributions to now vaccination programs. And our team has been able to pivot very quickly to accommodate all of these different phases of the pandemic that we are going through. And hopefully, and I pray, this will be the last phase. And by summertime, we will see a level of vaccinations or vaccines available so that anybody who wants the vaccine will have access to the vaccine. So rest assured, we are working long hours. Ms. Grimsley wanted to present tonight, but she is still on the phone at this hour, making sure that individuals are receiving their personalized phone call or their registration. And understand, when you register with the Riviera Beach pod, this is a very concierge service that's catered to and for our community. You do not get an electronic method of registering. When you call our phone number, your number is recorded and you receive a person calling you to ensure that your appointment is scheduled, where to be, and when to be there. And we also follow up with appointment reminder cards for your second vaccination. We have appointment reminder phone calls. So I know a lot of individuals have been frustrated waiting on their return phone call, but please understand, we are a small municipality doing very big things, and it may take 24 to 48 hours for you to receive a phone call. But I can assure you, if you call our hotline and you receive a message that lets you know that you will be receiving a return phone call, rest assured every one of those individuals will receive a phone call with personalized attention to you and you alone. It's not a robot, it is a person, and these persons are doing a great job protecting you throughout the community. That concludes my operational report. I turn it back over to you, Ms. Noel.
Thank you, Chief Curtis. At this point, I do want to share some information to everyone that is listening on our call this evening. Just so you're aware, we have a new mass communication system called Code Red, which was referenced by our city manager. And I think it's important for us to note that this is going to be the primary way in which we're going to get important information out to the community, especially as it relates to the vaccinations that we'll be doing more often in the future. And so if anyone is wondering how they can get that information or when it becomes available, please register on Code Red. You can simply go to Riviera Beach, all spelled out, rivierabeach.org/Code Red. When you go on that site, it'll provide you with instruction and information as to how you can register. You can do a text to enroll. You can register on the online portal, or you can call a phone number to have someone assist you with registering. If you do want to register by phone, you can call the number I'm about to give you. That number is 866-939-0911. Again, that's 866-939-0911. Select option 2. You can call anytime between Monday through Friday from 8 a.m. to 6 p.m. and a Code Red representative will assist you. And so with that being said, just make sure to share this information with anyone that you know. We send messages instantaneously through email, text message, and by phone call. And if you miss that call, you will have a voicemail left on your phone for you to access that message if you missed it for whatever reason. So please remember to sign up for Code Red. It's going to be critical, especially as we enter into hurricane season. Now we're going to open up the floor for any questions from those who are on this line. If you would like to ask a question of anyone that has spoken this evening, feel free to do so by dialing *9 so that I can unmute your line. And so I'll just allow a few seconds for you to do that if you have any questions. All right, seeing that there's no questions, we're going to go ahead and wrap up the call. We thank you all again for taking the time this evening for receiving the information that you've gotten tonight, and we'll continue to push out information through social media and our website. A lot of information, especially regarding COVID-19 information, is available on the website, and we push information through our social media on Facebook and Instagram. So please continue to follow the city as we work hard on a day-to-day basis to ensure that you have what you need. Good night.